Hello, and welcome to the Psyched podcast brought to you by the Women in Psychedelics Network. I'm your host, Kaya Roman, and I'm totally psyched today to be having a conversation with Courtney Barnes, amazing legal advocate for psychedelic compounds. We are going to get to hear all about the legal landscape happening in the country right now. Super exciting time for psychedelics. Just a little intro about me before we get started, who I am, why am I doing this? I've been working in the psychedelic industry for a number of years. I came to it through my own personal experience, like so many of us do. In 2017, psychedelics really helped me have a personal breakthrough. I had written a best-selling book called The Joy Plan about the neuroscience of joy. And then after I had my first psychedelic experience, I realized that everything I'd been writing about how to rewire your brain and harness neuroplasticity for creating the conditions for joy would be so much more effective after a psychedelic experience. So I've really dedicated my life to helping as many people as possible have access to these compounds legally, safely. And Courtney, I really join you in your mission. I know we both share the same passion and the same mission. I co-founded a company called KetaMD, working with the one legal psychedelic that we do have federally right now, ketamine, bringing ketamine to people at home safely while guided by nurses over telemedicine. I'm also the vice president of an R&D bioscience company called Psycheceutical. And I have worked with Courtney on some legal projects with a nonprofit called the Mind Army. So very excited to have this conversation with Courtney today. Let me tell you guys a little bit about her because she's incredible. So Courtney Barnes is an attorney, public speaker, and leading trailblazer in drug policy reform. She has unparalleled experience drafting and helping to implement policy reform measures relating to the decriminalization of psychedelics and the regulation of cannabis. She was a lead drafter of the nation's first psilocybin decriminalization ordinance, which is Denver's psilocybin decriminalization initiative in 2018, and has worked on dozens of other policy-related projects across the US. In addition to her legal practice, Courtney is a policy advisor for Decriminalized Nature, general counsel for the Society of Psychedelic Outreach, Reform, and Education, and sits on the advisory board of Heroic Hearts Project and the Mind Army. She's currently licensed to practice law in California, Colorado, and Texas. Thank you so much, Courtney, for being here.
It's my pleasure. This is such a treat.
Thank you. So first of all, I want to get into, what's going on with the laws related to psychedelics, but I thought you could explain for our listeners how psychedelics are currently scheduled at a federal level. I know there's Schedule 1, but what does that actually mean?
Yeah, I think that's a great first question. To kind of just give a primer on drug policy in the United States, drugs are regulated at the federal and state level, but primarily the federal level, and that is pursuant to the Controlled Substances Act of 1970. The Controlled Substances Act, or CSA, classifies drugs into 5 schedules based on potential for abuse, safety for use, and any redeeming therapeutic value. So Schedule 1 is the most restrictive, and it is illegal to possess, manufacture, or sell a Schedule 1 controlled substance without DEA authorization, which is really hard to get. Schedule 5 is drugs that are prescribable but are almost have no abuse potential. For example, Epidiolex was originally scheduled under Schedule 5, which is a CBD derived drug, but that contains no significant amounts of THC or anything like that. And then kind of in between, you go up that scale from Schedules 2 to 5 based on really abuse potential. So what's interesting is psychedelics, your LSD, psilocybin, mescaline, etc., are all classified as Schedule 1 controlled substances, with the exception, as you mentioned, not, I guess, formally a hallucinogenic compound, but ketamine is Scheduled 3. And that is because it has medical value, it's prescribable, it's FDA approved, but it does have some dependence liability, is according to the DEA. And so, yeah, where we're at right now is we have all of these incredible compounds being continued to classified as Schedule 1 drugs at both the federal and state level, meaning
Mm.
for all intents and purposes, they are illegal to the vast majority of people in the United States.
Right. Okay. Thank you for explaining that. So let's talk about how that's starting to shift. There, I know, are a number of state and federal legal initiatives underway. In how many cities are psychedelics now? I guess they're not exactly legal, but not being enforced. I know you were involved with Denver, the very first city that kind of decriminalized psychedelics in 2019. Now, where are we at? There's a number of cities across the country.
Yes. So even though we have the Schedule 1 classification, there are now 17 cities across the United States that have passed
Right.
some form of local legislation. And as I mentioned, because drugs or psychedelics are regulated at the state and federal level, there's only
Mm,
so much local municipalities can do to change drug policy. But
okay.
what they are doing is they're passing resolutions primarily, which are statements of policy of the city or town that say essentially, we believe that the city of X has far more important things to do with its law enforcement resources.
Right.
People are healing from these compounds.
Mm,
It is, arguably our right to nature, and it's not causing a public harm or health risk.
mm,
And so the most powerful kind of provisions in these types of resolutions are the city's lowest law enforcement priority. And then a lot of them also prohibit the city from using funds to arrest and prosecute adults engaging in all non-commercial activities. So this doesn't
okay.
allow sales, but it does kind of deprioritize your at-home grow, gather, gift model. So
Okay.
we have 17 cities across the country.
Yeah.
San Francisco was the most recent.
Yay.
But it's not a full protection again because it's at the local level. It's still critically important for our movement though. So really exciting progress. And then we additionally have one state now, Oregon, who has passed a psilocybin access model, which is incredible. And that will be implemented in January 2023.
And how will that work? Can you explain to us how psilocybin will be rolled out in Oregon?
Yes, so there's still a lot up in the air, but in essence, there will be a state cannabis similar, but not the same sort of licensing system where you'll be able to get a manufacturing license to produce psilocybin mushrooms for therapeutic use. And you can get a facilitator like service center license to sort of host where you would be able to go and purchase psilocybin and have a supervised and facilitated experience on site with a trained facilitator. And that'll be another kind of
Okay.
license. You'll be able to get a sort of guide license to sit with people and hold space for them while they're having these experiences. What's
Okay.
interesting about the bill is you aren't going to be able to purchase any psilocybin for take home. It's all got to
Oh,
be
okay.
consumed on site.
Right. And who's regulating that?
So the Oregon Health Authority, I believe, and then they have a couple of, I think, smaller departments that are also going to be in charge. It's definitely going to be a multi-agency sort of oversight, but
Yeah.
you fortunately do not need a particular health indication. So you, unlike medical cannabis, you don't have to have PTSD or pain or
Mm,
something prescribed by a doctor. You can make whatever decision you want for yourself. And as long as you're 21 years of age and older, can go to have this experience for really whatever purpose you desire. So whether it's spiritual, creative, healing, that is a great thing about the program. But sort of exactly how that will work out, how many people get access, whether
right.
municipalities will allow it. There's, but a huge first step in the right direction.
Yeah, for sure. I mean, congratulations to Oregon for being first. It's going to be really interesting to see what happens, how it rolls out, what kinks come up, what challenges, how things shape shift. And, if this becomes a model for other states, there are a number of other state ballots coming up, right? Colorado, New Jersey, Connecticut. I know you're working on something in Florida. Can you tell us what's happening with other states, what's going on with California, for example?
Yes. So Colorado is going to be on the November ballot for a similar measure. It's a psilocybin focused initially service state level licensing model, where again, you'll be able to get either a manufacturing license, a service center license, or a facilitator license, and provide that same sort of conceptual experience as is contemplated in Oregon.
Okay.
But what's different about Colorado is that it also encompasses the addition of other types of compounds in the future. So
Great.
while initial implementation is specific to psilocybin starting in, I think, 2026 or so, you'll potentially be able to have a mechanism for getting state level approval to perhaps add mescaline or ibogaine into the state level licensing system. Again, pretty sort of hopeful thinking in that 2 years is not really a long time for implementation of a brand new industry, and especially one of this type where you're holding so much like vulnerable space, and it's very health intensive, and there's just a lot of variables.
Right.
And then considering like the absolutely, in a lot of ways, vastly different use profiles and administration considerations and safety protocols required for sort of the responsible use of each different type of psychedelic. We're kind of creating a whole new world.
Yeah.
We are, and it's like you laugh because I say that out loud, and then I want to roll my eyes and be like, we've been using these compounds since, immemorial.
Right.
But in the way that our Western culture in America has had that exposure is not ancient, and it's not really spiritually and foundationally like grounded. So we're coming at it at this sort of medical model with as much space we can give for sort of this holistic healing that we're not familiar with and not very comfortable with, in a state level licensing model. So again, it's not perfect, but it's a step in the right direction, I believe.
Yeah. I mean, really, this is, like you said, these psychedelic compounds have been used for thousands of years, but this is a whole new paradigm for our Western world where we're trying to fit it into a medical model, to a legal model, make these available safely and in a way that can help people the most. So is every state kind of going about it differently? You talked about Colorado. Tell us about a couple of the other states that are, looking at different models.
Yeah, so there are about probably over a dozen states that have introduced bills this past year related to psychedelics. We sort of had Texas, which got some news earlier this year for starting a PTSD veterans research program that would allow for psilocybin to be administered in a controlled setting. While it doesn't go farther than what federal law would technically allow, it's a really important statement from the state of Texas, which is, very conservative and not progressive at all on drug policy, to at least say, hey, we care about our veterans and we think that there might be something real here. Yeah. So they were kind of a first, like they got a lot of news for that. And then New York actually just introduced there's a couple bills in New York relating to psilocybin. Some are sort of focused on decriminalization and creating a sort of community-based framework where localities would be expressly allowed to adopt policy related to psychedelics, which I think is huge. And then there's also some regulatory access models being proposed in New York as well. New Jersey has a bill that is, I'm not sure if it's been introduced yet or not, but that is a decriminalization of psilocybin and allowing for a sort of licensing model to be created. And then Dustin Robinson and I in Florida are working on a bill to just essentially ready the state of Florida for FDA approval of psilocybin and MDMA, but ultimately like all psychedelics going forward, just pretty much as big of a step as we believe Florida is ready to take. But hey, we're all about steps.
Yeah, for sure. I mean, that's the only way this moves forward. Can you explain the difference between what the FDA needs to regulate or approve and the DEA?
Sure. So the FDA regulates food, drugs, dietary supplements, cosmetics, and drug devices introduced into interstate commerce pursuant to the Federal Food, Drug, and Cosmetic Act. So they are in charge of the sort of manufacturing and marketing of drugs in commerce. So if you were to sell a product that makes a claim that it can treat anxiety and you haven't gone through the FDA approval process, you can get in trouble for marketing a misbranded or adulterated drug. The DEA is focused on the uniform enforcement of drug laws, primarily the import and export of controlled substances, but they do engage in domestic operations. But theirs is primarily the illegal like trafficking of controlled drugs, really outside of your traditional like commerce in the mainstream, but sort of like the black market, and again primarily focused on import and export. But they are more focused on obviously Schedule 1 drugs because they're illegal to produce and sell and manufacture without a DEA permit, and most people don't have that. And so their focus is more on that than going into a grocery store and being like, I don't think that this label is proper and that the ingredients don't match what it says it. So I would put it more as theoretically, FDA is more about consumer safety. As a consumer in the marketplace, is trying to ensure that you know what you're putting into your body, you can make informed choices, and that everything is truthful and accurate when it comes to what they're representing. Whereas the DEA is more about sort of public safety and, preventing exposure to drugs entirely.
That's such a helpful explanation, Courtney. I'm so glad I can ask you these kinds of questions. You're my resource for this. So then basically both are pretty important when it comes to psychedelic compounds. Both need to give it their own blessing, right? In their own way.
That's a great way to state that, because there was a lot of press when it came to President Biden's cannabis pardons and its declaration or proclamation to have the FDA and DEA sort of initiate a scheduling review for psilocybin, or excuse me, I wish, for cannabis. Wishful thinking there, but for cannabis. And while that is important, it's the first time a sitting president has ever requested that be done, and I think it will have some teeth given the kind of context he put that request in stating that he believes that people shouldn't be in jail for cannabis. But even if cannabis gets moved, or psychedelic gets moved from Schedule 1 to Schedule 2 or 3, it still keeps it in the FDA, and even really more so than Schedule 1, in the FDA's purview. FDA doesn't really focus on Schedule 1 drugs because you can't legally market them. That's probably the most simple way to put that. It's under their purview, but like there's no legal marketing of them. So the DEA is kind of there. But when it gets into FDA, then you're still in the pharmaceutical lane. So you still need to get your FDA drug approval. So cannabis or psilocybin were to be scheduled from Schedule 1 to 2, only companies that have that FDA approval for that cannabis derived drug would be in the legal zone now. So it's not simple, and that's really because the way that we structured our drug laws is just inadequate for all of the different types of compounds we are regulating, and just the world. But we're trying to like fit these things in the boxes that don't really.
It's ridiculous that there's 5 categories for all the compounds on Earth.
It's just wild. So ideally it would be some sort of state level, like states' rights kind of thing, where they just sort of fully acknowledge that, let the state decide how to regulate controlled substances within their territory. Easier said than done. Cannabis is kind of a good argument because we already have about 35 states with medical cannabis, so there's less pushback. But that, or decriminalization or descheduling, and descheduling would also give states more authority to regulate it as they see fit. But then you get into all of these interstate commerce issues, and so it's a cool, exciting area to be in, but it's you could talk about it all day.
It's complicated, but at least there's amazing forward movement. At least it's losing its stigma. There, so much more research is coming forward, and the FDA has given breakthrough status to, for example, MDMA through some of the research and clinical trials through MAPS, right? Can you talk to us about what's happening with MDMA?
Yes. So I haven't followed it, up to date entirely, but essentially they are in phase 3 of their clinical or drug trials. And so they should have FDA approval in the next, I think, 2 years. I know that it kind of keeps getting pushed backward and forward, but soon it will be the first psychedelic to receive FDA approval. And the breakthrough therapy status is essentially applies to drugs that are used in sort of life-threatening for conditions and that are shown in early stages to be significantly more effective than the FDA approved options that are on the market. So for, PTSD, there's really just not good options for treatment. And so to have psilocybin come out, or MDMA, and show such promising results allows them to sort of skip over some of the bureaucracy in the FDA approval process to provide access in limited circumstances before it gets fully FDA approved. But it's not a real solution, in that it doesn't help as many people as it should. But the thought is correct in that these products are really effective. Therefore, they can save lives, and
that's for sure.
Our 10-year drug approval process is just toxic.
Yeah. So under that breakthrough status for people with PTSD, even if those compounds are Schedule 1 with the DEA, they can still be used under certain limited circumstances.
So they have to be at a certain stage in the drug approval process. So you can't just sort of pick one out and say, let's go. But then you can apply, once you show those clinical studies that, hey, this is safe and effective for that life-threatening condition, you can apply to get that designation, or the FDA will grant it. And then certain patients can, I believe, work with their doctors to apply to the manufacturer to get access. And I'm not certain exactly on the procedural details there, but that's what it is intended to do, is to be able to get people who are suffering from life-threatening conditions like a chance to try kind of trial medicine that may or may not work, but it's worth the risk in their professional and personal opinion.
Yeah, that's great. I mean, so many of these are just steps in the right direction, and it is such an exciting time for psychedelics. I can imagine your daily life must be so exciting, just seeing all these different legal ballots being involved in writing up the policies, waiting anxiously for new votes and seeing how these things are going to unfold. So I just want to personally really thank you, Courtney, for your work, for your mission, for everything that you're doing to move this medicine forward and bring access. And my last question for you is, if you had a crystal ball and you could predict, where you think the legal landscape is going to go, let's say over the next 5 years, how would you predict things are going to roll out at a state and federal level? And then kind of along with the crystal ball, there's also, what if you had a magic wand and you could wave the magic wand and, really roll this out how you think it would be best from a legal perspective?
Okay. I love this game. So crystal ball, not my manifestation, but if I was looking into the looking glass, I would say we'll have at least 50 cities with decriminalization legislation passed. I think we'll continue to see that progression move. And I would say probably 4 or 5 states with at least psilocybin programs at the state level. I think once Oregon gets implemented, there's gonna be a lot of criticism and a lot of I could have done that better and differently. Sure. But after a year or so, we'll have better data, and just like cannabis policy, other states will learn how to do things better as a result of watching a first mover. Yeah. And and definitely MDMA and psilocybin will be approved at the FDA level, which is incredible. And that should sort of be a catalyst for expedited approval of MDMA and psilocybin for other conditions. So not just, PTSD, but potentially, addiction or anxiety or any depression, which I guess is already in the works there. But once we have those safety profiles, the drug formulations aren't going to change that much, or they shouldn't need to, because these psychedelics do what they need to do without anything else. So I think we'll see a quicker progression of expanded access for other types of indications for MDMA and psilocybin, and then hopefully we'll see ibogaine and DMT and LSD truck along the drug approval process too. So that's my crystal ball of being optimistic. But if I had a wand, I want, like, you know, the whole country to be decriminalized. I think that at least if we can do cannabis simple possession, we should do all drugs simple possession. Not enough, but that would be amazing. And then see that, like, at least 100 cities. Yeah, for sure. And then I would say, hopefully with the decrim movement happening as quickly as it is, we will open our, like, hearts and minds to what a, you know, better world could look like for psychedelics, because I am honestly not super thrilled about just keeping the status quo with this sort of cannabis like regulatory access model at the state level. I'm willing to advocate for access at the state level because that's what we have to work with. But I hope that the more people that can use psychedelics and have these spiritual and sort of opening experiences, we can realize that, like, we can hold a different container for them and have more respect for the indigenous use and the spiritual use and the religious use, and you know, offer regulated state licensing systems for those that feel like they need that type of container, but accept that so many other people, you know, may not, and that might not be what they need for their healing when it comes to psychedelic use. So that would be my hope, is that we can get more creative with our drug policy. But the crystal ball is much better than today. So
yeah, well, I sure wish I could give you a magic wand, Courtney, but I really do appreciate your insight, your predictions. What are your final parting words for our listeners? How can people get behind and support the legalization of these compounds, and how can they follow your work?
Yeah, so my call to action in the best way that you can help progress this movement right now is to talk about your experience using psychedelics. If you've had a beneficial or spiritual or therapeutic or fun time on psychedelics,
I
to
love
not be
that.
afraid to, like, talk to it with your mom or your sister or your neighbor or the guy at the gas station. And just because you would be so surprised with how open people are to, like, one, authenticity, and two, like, healing, that it's not as scary as it needs to be. And so that's my initial one. I think also, if anyone, you know, one is passionate about it and knows a politician or a local, you know, official or someone that sort of has a position of power to at least make a statement, whether it's district attorney, etc., like, you'd be surprised also how impactful an email or a statement of policy or just a position paper from people in positions of influence can have an impact. So that's that. My Instagram is cbgoes_global if you want to follow my adventures. And I'm always, open for questions, and feel free to reach out to me as well. So
awesome. Thank you so much, Courtney. I definitely do recommend following Courtney's adventures on Instagram. She's always up to something interesting. And I love that. You know, how can we help move this medicine forward? Have healing experiences and then share them. We're all part of breaking this stigma and keeping the conversation going. It is amazing how much more open people seem to be. You know, when I started having psychedelic experiences in 2017, it was like a very taboo underground thing. Definitely wasn't talking to the person at the grocery store about it. And now everybody wants to know and wants healing, and, you know, everybody's experiencing higher levels of trauma and depression, anxiety, and looking for answers. So go have healing and share your experiences. And I love that, you know, to also reach out to the people in your local government who can make a difference. As Margaret Mead said, never doubt the power of a small group of dedicated individuals to change the world. In fact, it's the only way things have ever changed. So thank you so much for being part of that change, Courtney. Thanks for taking the time to have this conversation with me today, and we'll catch up soon.
thank you so much. My pleasure.